Multiple sclerosis is a condition that affects motor function, sensory function, and sometimes cognitive function as well. And exercise is tremendously beneficial for people with MS for a variety of reasons. First, exercise enhances motor function. And when people have an attack from MS where they become weak, the simplest way to get them back on their feet again or back using their limbs again is through exercise. And the most clear-cut example of this is when you give somebody a prescription for physical therapy and then you see them back in the office, you can measure their improved strength. And a lot of the things that they learn in physical therapy involve exercises of various types that they could also do on their own once they've been trained on how to do it. Exercise has a whole other benefit, which involves a sense of quality of life. People who exercise with MS compared to those who don't feel better about themselves. They have a closer engagement with the things and people around them. And overall, they just have a more positive outlook. So that's very important in MS because almost 50% of people with MS will have a mood disturbance by the time they reach 50 or 60. So anything that you can do to avoid that kind of problem is very important, and exercise is a relatively straightforward way of combating some of the mood disturbances that can occur in this disease. For some people with MS, they start getting isolated, they start staying in their home, and they pursue a sedentary lifestyle. And that's the worst thing you can do. For one thing, the isolation isn't good. So using exercise as a way of meeting people, getting together with people, working out with people is very good from a socialization point of view. Also, improving your oxygen consumption and overall aerobic capacity is very beneficial in MS as it is in other conditions. So there's many different ways in which exercise can be psychologically, physically, and emotionally beneficial for people with MS.